Have you ever heard of a dental treatment where your dentist gently reshapes your gum line to save a tooth or enhance your smile? It's called dental crown lengthening. A small procedure with a big impact. It involves reshaping or removing a small portion of gum tissue and sometimes a tiny bit of bone around a tooth. The goal is to expose more of the natural tooth structure. There are three main reasons your dentist might recommend this procedure. 1. Restorative needs. If a tooth is broken, decayed, or worn down near the gum line, the dentist needs more surface to properly place a crown or filling. 2. Cosmetic improvement. For patients with a gummy smile, crown lengthening gently recontours the gum line to reveal more of the natural teeth, creating a brighter, more proportional smile. 3. Better oral health. In some cases, it helps reduce deep gum pockets, making it easier to clean and maintain healthy gums. The results can be dramatic. A strong foundation for crowns or fillings, better gum health with easier cleaning, a balanced, more confident smile. It's a small change with lasting benefits, both for your oral health and your appearance. Dental crown lengthening might sound complex, but it's a safe, effective way to save a tooth. Did you find this helpful? Give this video a like, subscribe for more dental tips, and share it with someone who might be curious about this life-changing treatment.